stress. We're going to start out if they're hypoxic, SATs less than 92% with a nasal cannula. The patient should always have a mask over their face regardless of what intervention you're escalating to. The nasal cannula can be increased to a total of 6 liters. If your patient remains tachypnic, hypoxic less than 92%, the next escalation will be to high flow nasal cannula, the green tubing that's humidified. Again, we'll switch that tubing off, take this tubing out, switch the green tubing on, mask goes back over. That will escalate to 15 liters. If the patient continues to deteriorate, continues to be hypoxic, tachypnic, the next step will be high flow, heated humidified nasal cannula, in which case the flow for that can go anywhere from 15 to 60 liters. If you extend beyond the heated high flow nasal cannula, continue to be tachypnic and hypoxic, the next step will be this mask system that we're going to go through. It's effectively a CPAP system without a machine, just 2 sources of oxygen. What you're going to need is a plain old nasal cannula. We're going to go back, place a simple nasal cannula like Jen has on her nose now, and you're going to need your viral filter, PEEP valve, ambu bag, and the full face shield, BiPAP mask with the blue connector. It has to be the blue connector. If it's the small face shield that just goes over the mask, those connectors have exhalation ports there that will need to be covered if you don't have this blue connector on. And so the first step, nasal cannula will be on at 4 to 6 liters. We're going to put the mask over, connect that, nice tight seal.
So the bag valve mask comes with a diverter on it. To put the PEEP valve on, you're going to need to remove the diverter, and then you'll see what you're familiar with. The PEEP valve itself comes with an adapter. You'll have to remove that adapter as well, and then install it onto the bag valve mask.
Okay, oh, that stays on. Pop that back in. Okay. The next thing that's going to go in line is the viral filter. Viral filter. Ambu bag. And then the connector off.
Remove that connector.
Yep. Take the PEEP valve as Ron's showing, and Ron was nice enough to show us. The PEEP valve is adjustable. So you titrate the PEEP based on the patient's comfort. You want to start it at 5. Twisting this will increase the PEEP. So you start it at 5 all the way down. You're going to attach that through here. And then we're going to hook this connector with the ambu bag to 25 liters. If you feel the patient does truly need CPAP in there, more pressure support, you can increase the oxygen tubing, the nasal cannula 4 to 6 liters, and that provides backflow for pressure into the mask. So you can either use this with or without the nasal cannula. If you want true PEEP in there, the nasal cannula needs to be on at 4 to 6 liters to provide that back pressure. This will be connected to oxygen at 25 liters. And then adjust your PEEP valve based on the patient's comfort and what they can tolerate. Yeah. If the patient continues to decline despite this mask, you're going to keep this on until intubation, because this is a really good way to pre-oxygenate the patient, since we absolutely will not be bagging the patient. For intubating the patient, if you haven't seen the video, there's already a video to set that up. Once you watch that video and you intubated your patient, what you're going to do is an ARDS-NET protocol. 4 to 6 mLs per kilogram ideal body weight, which is based on the patient's height. Not a morbidly obese patient should not have tidal volume set at 600 or 700. 4 to 6 milliliters, ARDS-NET protocol, and then we're going to start our PEEPs out 10 to 12, not our usual 5 a PEEP for these patients. They need high pressure PEEP and low tidal volumes. And that's where really you're going to start. Oh, the other piece of that puzzle is the FiO2. You're going to start at 100%, but titrate down as quickly as possible. What the literature is showing is that really high flow of that high FiO2 is doing more damage than good. So be sure to titrate the FiO2 down quickly.